let's talk about how a tight pelvic floor can disrupt your birth flow. All right, let's look at labor. So in the early stages of labor, baby's coming into the pelvic inlet. And in most of our bodies, we're widest from side to side. So the baby's coming in with the forehead to one side and the back of the head to the other side. As labor progresses, the head meets the pelvic floor at the mid-pelvis, that's about 6 centimeters-ish, and that helps the head rotate into that 90-degree rotation. So the pelvic floor ideally is springy, like a trampoline. So I'm going to use my TheraBand as if it is my pelvic floor. So if you've ever jumped on a trampoline that was too tight or pulled too taut, you jump on it and you don't really bounce. It may actually reverberate discomfort up your spine. Or if one is too soft, you kind of drop and you don't really have that spring. That's kind of the same with the pelvic floor. We want these muscles to be springy, to be able to yield and support. So as the baby's coming into that mid-pelvis, hitting your responsive, yielding pelvic floor, it helps it rotate 90 degrees. And in that rotation, it helps the chin go into the chest. And that helps present the smallest part of the baby's head against your cervix and helps the cervix dilate. Now, what happens if this is a really tight pelvic floor? Instead of yielding, it could hit this tight pelvic floor, and instead of keeping the chin into the chest, it could actually draw the chin away from the chest, or it could draw the ear to the shoulder. Now, both these can be disruptive because instead of having the small part of the baby's head pushing through the cervix, it's like threading a needle. Now we have the chin away from the chest, and we have the bigger forehead trying to go through. Or you have the side of the head. So now we have this asymmetrical pressure against the cervix, and that can disrupt birth flow. So if you listen to this, you're like, oh my goodness, what happens if my pelvic floor is tight and I'm in labor? There are things you can do. Now, in past videos, we went over some of those, so make sure you check those out. So as I was mentioning, the pelvic floor starts at the mid-pelvis. So there's positions that you can take to help the pelvic floor muscles yield and stretch. You can do asymmetrical poses like a little side lunge. You could be on all fours with your knee on a block, and that is going to help widen the mid-pelvis and help those muscles stretch. We could look at things like the sit bone spread. You could also do a side lying release. That is from Spinning Babies and the Body Ready method. So there's things you can do. Now, years ago, when I was a doula, I was working with a client who ended up having a very tight pelvic floor. And we were working through all the positions. And at one point, her OB pulled me aside and said, can you suggest an epidural to your client? Because the epidural can be a great tool when those muscles are really tight to help them relax. And I mentioned it to my client, and she wanted to wait a little bit before. So we got in the bath. Well, she got in the bath. I was with her. I was helping her relax. We did all sorts of shaking the apples and trying to help things release the tension. Now, by the time we hit hour 36, she had decided, okay, let's try the epidural. And for her, it was fantastic. What it did was all that tension that kept accumulating as she was working through those contractions helped her muscles relax, and that baby descended and rotated through pretty quickly. So there are so many tools you can use during labor should you encounter that tension in the pelvic floor, but there's things you can do before labor. Again, check out some of my past videos. We talk all about 360 breathing to help the pelvic floor be in a more relaxed state. We do all sorts of positions in our yoga classes to help find that length in the pelvic floor, and different ways to relax your nervous system to also relax your pelvic floor. So follow along for more tips to help your pregnancy and your birth and your labor. Hope this helped.